NCLEX National Council Licensure Examination, NCLEX PN, NCLEX PN free exam questions. Question 1. A nurse is planning a brief treatment program for a client who was raped. A realistic, short-term goal is to: Option A, resolve feelings of trauma and fear. Option B, eliminate the client's enticing behaviors. Option C, identify all psychosocial problems. Option D, verbalize feeling about the event. The correct answer is option D, verbalize feeling about the event. Question 2. A nurse walks into a client's room to do an assessment and discovers that the client is unresponsive. The nurse shakes the client and calls his name, but he does not arouse. What should the nurse do next? Option A, check the pulse. Option B, call for help. Option C, give defibrillation. Option D, open the airway. The correct answer is option B, call for help. Question 3. Following an automobile accident that caused a head injury to an adult client, the nurse observes that the client sleeps for long periods of time. The nurse determines that the client has experienced injury to the: Option A, medulla. Option B, hypothalamus. Option C, cortex. Option D, thalamus. The correct answer is option B, hypothalamus. Question 4. Client self-determination is the primary focus of: Option A, nursing's advocacy for clients. Option B, confidentiality. Option C, malpractice insurance. Option D, healthcare. The correct answer is option A, nursing's advocacy for clients. Question 5. A batterer is usually someone who: Option A, was an only child. Option B, was physically or psychologically abused. Option C, admits he has a problem with anger. Option D, grew up in a loving, secure home. The correct answer is option B, was physically or psychologically abused. Question 6. Which of the following strategies should the nurse include when planning care for children of migrant workers? Option A, schedule preventive services at acute illness visits. Option B, provide parents with copies of medical records. Option C, delay immunization because of acute illness. Option D, stress the importance of using one primary care provider. The correct answer is option B, provide parents with copies of medical records. Question 7. The nurse has completed client teaching about introducing solid foods to an infant. To evaluate teaching, the nurse asks the mother to identify an appropriate first solid food. Which of the following is an appropriate response? Option A, pureed apples. Option B, infant rice cereal. Option C, pureed canned squash. Option D, yogurt. The correct answer is option B, infant rice cereal. Question 8. Which cultural group has the highest incidence of inflammatory bowel disease, IBD? Option A, Asians. Option B, Caucasians. Option C, Hispanics. Option D, African Americans. The correct answer is option B, Caucasians. Question 9. The nurse explains to a client who underwent gastric resection that which of the following meals is most likely to cause rapid emptying of the stomach? Option A, a high carbohydrate meal. Option B, a large meal regardless of nutrient content. Option C, a high fat meal. Option D, a high protein meal. The correct answer is option A, a high carbohydrate meal. Question 10. A high school nurse observes a 14-year-old female rubbing her scalp excessively in the gym. The most appropriate course of action for the nurse to do is: Option A, observe the hairline and scalp for possible signs of lice. Option B, contact the student's physician. Option C, request a private evaluation of the female's scalp from her parents. Option D, contact the female's parents about the observations. The correct answer is option A, observe the hairline and scalp for possible signs of lice. Question 11. A 14-year-old boy has been admitted to a mental health unit for observation and treatment. The boy becomes agitated and starts yelling at nursing staff members. What should the nurse's first response be? Option A, ask the patient, what is making you mad? Option B, create an atmosphere of seclusion for the boy according to procedures. Option C, remove other patients from the area via wheelchairs for added speed. Option D, ask the patient, why are you doing this? Have you thought about what your parents might say? The correct answer is option B, create an atmosphere of seclusion for the boy according to procedures. Question 12. Which of the following procedures describes an opening between the colon and abdominal wall? Option A, cecostomy. Option B, jejunostomy. Option C, colostomy. Option D, ileostomy. The correct answer is option C, colostomy. Question 13. Pulling is easier than pushing. So pulling a client rather than pushing him or her has which of the following advantages? Option A, prevents muscle strain. Option B, maintains stability. Option C, reduces workload. Option D, decreases opposition from gravity. The correct answer is option C, reduces workload. Question 14. A 2-year-old has been in the hospital for 3 weeks and seldom seen family members due to isolation precautions. Which of the following hospitalization changes is most likely to be occurring? Option A, guilt. Option B, trust. Option C, shame. Option D, separation anxiety. The correct answer is option D, separation anxiety. Question 15. When discussing possible complications of pregnancy with a client, the nurse should explain that all of the following are symptoms of urinary tract infection, UTI. Which of the following is least indicative of UTI during pregnancy? Option A, GI distress. Option B, malaise. Option C, low back pain. Option D, urinary frequency. The correct answer is option D, urinary frequency.